For the first maybe 6-7 years of MRI fusion biopsies, we used different systems with electric magnetic field generator, also called rigid fusion. And once the fusion get disturbed, it could be by patient movement or patient coughing or something else, then you would have to do your fusion again to be precise. Then for the last maybe 4 years, we have been using the Coelis system, first for transrectal biopsies, but for the last 18 months for transperineal biopsies. And Coelis uses elastic fusion and organ-based tracking, meaning that we get an update of the fusion during the procedure so that we can follow the prostate. If it moves, it doesn't matter. We get an update of the fusion during the procedure. The reason we changed from transrectal to transperineal biopsies is because of the infection risk, which has been rising over the last decade in all over Europe, all over the world. And we had here in our local hospital, we had an infection rate of about 7 to 8% after transrectal biopsies. So we had to shift to transperineal biopsies, as also the guidelines say we should do. And after that, we've done, of the first 650 patients, only 0.5% has been admitted to hospital afterwards. And some of them didn't have septicemia, they were just feeling lousy, but no sepsis. So it's a very dramatic improvement of this technique. And we used to do transrectal biopsies with image fusion with the Coelis system, so I was familiar with the software and the technique. So it's very easy to shift to transperineal using the same software and organ-based tracking, so that we get update all the time on what we're doing. So it was a simple procedure to shift to. From the patient comes in and lies at the table until the procedure is done and he's back in the chair, it takes about 15 to 20 minutes. That includes anesthesia, local anesthesia, disinfection of the skin twice, and then the planning and the biopsies. If you are used to doing transrectal ultrasound and maybe transperineal procedures like brachytherapy or other procedures, then the learning curve is very short. But I can say I have a colleague who had done transrectal procedures but never transperineal procedures. And I supervised him for maybe 10 cases, and he was then on his own with the Coelis system. So the learning curve is short.